Inhale. Exhale. We do this at least 22,000 times a day. That is why we want you to live your best lung life.
The Lung Life webinar series empowers us to live our lives and breathe easier.
Lung Saskatchewan has partnered with GSK to offer a free 5-part webinar series featuring key opinion leaders in their respective fields of expertise, all with one goal: for you to live your best lung life.
We know that education, treatment, and support are vital for lung health, whether it's to manage an existing lung disease or to prevent lung disease altogether.
I have learned something new on every webinar that I've attended with Lung Sask.
The Lung Life webinar series offers a wide variety of topics, including disease-specific presentations, as well as education on lung disease prevention.
The Lung Life webinar topics include sleep apnea, asthma and allergies, pneumonia, COVID, and influenza vaccines, quitting smoking, and everything you need to know before you go for a spirometry breathing test.
The knowledge we gain from science and research makes for a better and healthier tomorrow. It is constantly evolving. The Lung Life webinar series helps you stay informed. Do you know that 1 in 5 Canadians have lung disease? Asthma is common but serious, and one of the leading reasons for emergency department visits in children. 30% of Canadians are at risk of developing sleep apnea, a disease where you stop breathing in your sleep. And of course, anyone with lungs can become infected by viruses that leave us breathless. These webinars are not only for people with lung disease, but for anyone with lungs.
Knowledge is power, and it can help us all breathe a little easier.
To find out more about the Lung Life webinars and to register, visit lungsask.ca. Missed a webinar? Don't worry. The recordings will be on our website for you to view at any time. Live your best lung life. Visit lungsask.ca today.
Good evening. Thank you for joining us for tonight's Lung Life webinar, Asthma and Allergies with respiratory therapist and certified respiratory educator, Sara Han. My name is Jill Hubik. I'm a registered nurse and certified respiratory educator with Lung Saskatchewan. It is my pleasure to welcome you and to be your host and moderator. Before we begin the presentation tonight, I would like to acknowledge that the land we're hosting this webinar on is on Treaty 6 territory, the ancestral and traditional territory of the Cree, Dene, Blackfoot, Saulteaux, and Nakota Sioux, as well as the territory of the Métis. Lung Saskatchewan affirms our commitment to reconciliation and the Truth and Reconciliation Commissions of Canada's calls to action. We acknowledge the many First Nations, Métis, and Inuit whose footsteps have marked these lands for generations and are so very grateful we are able to host this event where we are. Supporting and helping people living with and caring for people with lung disease is a priority for Lung Saskatchewan. We offer a variety of online support groups for patients and caregivers. The support groups include asthma, COPD, pulmonary fibrosis, COVID-19, lung cancer, lung transplant, sleep apnea, and Saskatchewan Quits to help people quit smoking. These support groups are to help those living with lung disease or for those who want to quit smoking and navigate their journey in a supportive way. Providing education and support is one way we hope to help you live your best lung life. If you are not a member of our Lung Saskatchewan support groups and you would like to be, visit our website at lungsask.ca. Asthma is a chronic disease that makes it hard to breathe. The airways in the lungs are more sensitive when exposed to certain triggers. The disease is also common, affecting about 10% of all Canadians. People can have allergies or asthma. However, many people have both. Allergies increase your chance of having asthma and can make asthma symptoms worse. We are excited to learn about asthma and allergies and things we can do to better manage them with our presentation tonight from Sara Han. It is now my pleasure to introduce our presenter. Sara Han works as the Lung Health Foundation's Manager of Community Program and Partnerships. In this role, she manages the delivery and growth of the Lung Health Foundation's Fitness for Breath program, which is a maintenance exercise program model for anyone living with lung disease. She also manages peer support group programming and leads a national virtual peer support group. Prior to taking on this role, Sara was the manager of implementation primary care, working with healthcare professionals and certified respiratory educators to deliver evidence-based programming in primary care settings. Sara is a registered respiratory therapist and a certified respiratory educator with clinical experience working in the hospital and in community-based settings in Ontario. She is also a Teach Train Smoking Cessation counselor, and Sara's presentation is so timely, as many people with asthma and allergies can find that these worsen in the fall. Asthma is very common, but it is also serious. Thankfully, both asthma and allergies can be treated. However, like with any lung disease, management starts with education. And tonight's presentation is the third of a 5-part series. Specifically, it is the third presentation this year in our 2023 Lung Life webinar series, which is sponsored by GSK. Lung Saskatchewan and GSK have a long history of working together on activities to improve the lives of those living with lung disease. This education webinar series, Lung Life, was created to empower those living with and caring for those with lung disease to live better. This is the third year of our Lung Life series partnership, and together Lung Saskatchewan and GSK will be bringing you presentations on different lung health topics throughout the year. So if you miss any of these webinars, we hope you'll visit our website, lungsask.ca, where you can review and view their recordings. The Lung Life webinar series would not have been possible without GSK, a science-led global healthcare company with a special purpose: to unite science, technology, and talent to get ahead of disease together. The Lung Life webinar series is rooted in science. It utilizes technology to make education from a talented expert accessible to you, wherever you are. I'm very pleased to welcome Marie-Claude from GSK to bring greetings and to welcome our presenter.
Bonsoir everyone, my name is Marie-Claude Zonier and I am the Patient Engagement Manager at GSK in the Patient Affairs and Advocacy team. In the scope of our work, we engage with patient organizations by listening to patients throughout the life cycle of our medicine, integrating those insights into our business planning to improve patient outcomes. GSK is very proud to collaborate with LungSask and to support the 2023 Lung Life webinar series. LungSask is providing you with accessible, practical, evidence-based information and strategies coming from key leaders in their field of expertise. The topics of these webinars have also been chosen based on your feedback, which is so important to listen to in order to bring the relevant informations which we hope will help you live a better long life. Thank you very much and have a great evening.
Hi, everyone. Thank you to LungSask and GSK for inviting me tonight to speak about asthma and allergies. Thank you to Jill for introducing me. I am the manager of community programs and partnerships at the Lung Health Foundation, and I manage peer support programs and community-based programs for those living with lung disease. So I'm very happy to I'm here to teach you a little bit about asthma and allergies and some of their connections so that you can have more knowledge and more tips and tools to how to better manage your asthma and allergies. So the learning objectives for today that I will cover, so what is asthma, what is an allergy, what is an allergen, how do allergies affect asthma, how are asthma and allergies treated and how are they connected? And also, lastly, what is anaphylaxis? So those are the points that I'll be going through in the hour that we have today. So what is asthma? So asthma is a chronic disease. So what that means is when you are diagnosed with asthma, you have it in your airways. And it's not that you get it all of a sudden and it goes away and you don't have it anymore. It lives in your body. It lives in your body, and so what that means is you have to manage it on a daily basis. So it's like having high blood pressure or diabetes. You have to manage it on a daily basis. So it's only when the airways swell and become inflamed by triggers of when we start seeing the symptoms of asthma. Triggers can include allergens and irritants that can make the airways react, causing asthma symptoms. So you can see on the picture on the right, I have on the left airway. So airways are passages in our lungs that allow us to breathe in. So it brings the air in, it brings the air out. So the picture on the left is a picture of a normal airway. And you can see how there's muscle bands around it. So think of those as elastic bands. They're nice and wide open, nice and relaxed. And then within the airway, you have the tissue lining around it is nice and normal, it's not inflamed. And then also you have a nice open airway without any sputum, mucus, or phlegm inside. The picture on the right side is when your lungs, if you have asthma and allergies, you get exposed to a trigger and then it causes a reaction. And that reaction includes the tightening of those muscles around the airway. It's almost like it's strangling your airways. The tissue around it also gets inflamed or swollen, and then also mucus builds up in that opening so that you can imagine, I call that a triple threat. And so air was able to go in nice and out easily, it's now very difficult to breathe in as well as breathe out. And that's when you run into trouble because you get into symptoms including shortness of breath, coughing, wheezing, or that whistling sound in our lungs, sounds like a harmonica. You have chest tightness, it feels like there's an elephant sitting on your chest, and you also have mucus production causing you to cough more. For asthma, symptoms are worse at night and in the early morning. And so we'll be talking about some variations in asthma as well in terms of symptom management. So that's sort of a sneak peek as to what might happen when you get exposed to those triggers. So who gets asthma? Asthma can develop at any age. There's a myth that asthma develops as a child and you can actually grow out of it, which is true in some cases, but in some cases they can grow out of it. And then some people actually, once they've grown out of it, they can develop it at a later point in their life. What we also know too is that asthma can develop at any stage. So whether you're a teenager, an adult, or even seniors who've actually never had asthma and they develop it all of a sudden. There are many factors influencing whether someone may be at risk of developing asthma. So that's a familiar history. So parent, brother, or sister having asthma or allergies puts you at higher risk. Also environmental exposure, so exposure to allergens, and also smoking prenatally, postnatally could be examples of environmental exposures, and also personal history of allergies. Those all contribute to a higher risk of developing asthma. So how do we know it is asthma? It is really important to diagnose asthma properly in order to treat it properly. We have a huge epidemic in that there's a lot of asthma that's underdiagnosed and also that asthma that's overdiagnosed. So it's really important that we diagnose it properly. The gold standard to diagnose asthma is a simple breathing test called spirometry. It can be done in any physician office in primary care. People think that it is just done in specialized, hospital centers or private labs where they do pulmonary function testing. That's actually, you can get it there, but over the last several years, it's become more and more available in physicians' offices because they now see the importance of doing spirometry, in the everyday, and also they have really increased the number of operators that they're hiring, such as RTs and other healthcare professionals who have the training available to do spirometry at these offices. As spirometry is inconclusive, your healthcare provider might send you for further testing, such as methylcholine challenge testing or exercise challenge testing to confirm whether it's asthma or not. And those are actually done in those pulmonary function testing centers in hospitals or private labs. Once the asthma is diagnosed, it is really important to work with your healthcare provider to know what medications you need to be on in order to maintain good control. And we'll be talking about control as you'll see it as we go throughout this presentation. And the reason why we emphasize that in asthma is that it actually can be achieved. You actually can maintain good control with the proper education, with the proper controls, as well as taking your medications properly as well, which we'll be going through. So not only does asthma have impact on the individual person, but it also has an impact on our society. So more than 3 million Canadians live with asthma, and asthma is the leading cause of emergency room visits, hospital admissions, and school absenteeism. And is actually very high in the pediatric population. It's one of the top reasons why kids oftentimes get admitted to emergency rooms. Asthma can be controlled, however, asthma also can be fatal without proper management and access to medication. In 2013, 259 Canadians died from asthma, and that should not be the case. Like I said, asthma can be controlled. We shouldn't have incidences like these where we're still seeing people dying from asthma. We do have really good treatments, now in 2023, and this should just not be the case. One case I will tell you about is a case in Ontario that happened in 2012. A boy by the name of Ryan Gibbons passed away. It was actually at school during recess time. He had an asthma exacerbation or flare-up, and he didn't have access right there of his rescue inhalers. It was actually locked up in a cabinet somewhere inside the school. And so what happened after his case was that there was a law called Ryan's Law that was passed in Ontario in 2015. It requires all school boards in Ontario to develop and maintain asthma policies and procedures that help protect students who have asthma. Schools are also required to allow students with asthma to now carry their emergency inhalers with permission from their parent or guardian. This law also included training for teachers as well on how to help their students in terms of taking their inhalers. And so here at the Lung Health Foundation, we've been doing a lot of education with school boards in the last several years. We also work with an organization called FIA, and they actually have creating asthma-friendly environment curriculum that we work with them on. I'm not sure exactly what happens in other provinces, but I know a lot has been learned through this law that was passed. Not only for asthma actually, but Ontario, in addition to Ryan's Law, we actually have what's called a prevalent medical conditions policy, where in addition to asthma, we have anaphylaxis, diabetes, and epilepsy. And those 4 cases in schools, we require a plan in place, a policy in place to manage those conditions, those life-threatening conditions at school. And so we have that in place from what we learned. So I'm going to go back to this picture again. So what a controlled asthma looks like and what an uncontrolled asthma looks like. And so you can see the difference between the two in terms of how easy it is for us to, breathe and let the air get in and out our lungs, and then an uncontrolled asthma where with that triple threat, the muscles tightening, the lining in the airway is swollen and inflamed, and then you also get that extra mucus buildup in there that all works to make it so difficult to breathe. So common causes of asthma flare-ups or exacerbations include infections, whether it be viral or bacterial. We also have a common one is exposure to smoke or vape. Exercise can also induce an asthma flare-up or exacerbation. Exposure to allergens or irritants. Stress and anxiety is also another big one for some people, and also exposure to air pollution and air quality. So these are the common causes that you would see that can actually trigger an asthma flare-up or exacerbation. So we'll just kind of dig deeper into the allergy and allergens and irritants for a little minute here. So what is an allergen? What is an allergy and allergen? So an allergy, think of it as the umbrella. It's when our immune system reacts to or is sensitive towards a substance, which is the allergen. Allergens are the actual substances that can cause an allergic reaction. Common allergens include pollen, dust mites, animal pet dander, or certain foods. Some people may not have a reaction to these substances, but for those who do, sensitivities and reactions can vary. So the main differences between an allergen and irritant, I will kind of show you. So allergens, again, are substances that can cause an allergic reaction in our body. So not everyone who's exposed to an allergen will have an allergy to that substance, only those who are sensitive towards it. Whereas an irritant is a substance that can trigger a reaction in anyone. So allergens, when you're exposed to them, it can last longer. It can be a delayed response, and it's less easily reversible. Whereas an irritant is, when you're exposed to it, you get it sort of an immediate reaction. It tends to be short-lived, and it's rapidly reversible, usually in most cases. So common allergens include mold, dust mites, animal danger, and food. And common irritants include tobacco or vaping smoke, extreme weather conditions such as hot, humid, or extremely dry, cold weather, stress and anxiety, strong odors from chemicals, sprays, or whatnot, physical activity, and infections. So I'll dig deeper into those allergens and irritants in the next few slides. So how do allergies affect asthma? So asthma, like I said, is a chronic inflammatory disease of the airways, and when exposed to triggers like allergens or irritants, it can make the airways react by, again, going through that inflammatory cascade. It swells up, it tightens, and fills up with mucus. This reaction can make breathing difficult, and if left untreated, can be life-threatening. Since asthma symptoms are dependent on the exposure to triggers such as allergens or irritants, it is really important to know how to limit your exposure to them. So I'll be going through some of that. So asthma and allergies are related, but they're not the same. The inflammatory process or cascade that happens in the immune system is similar. Though many people have both asthma and allergies, there are people who have allergies without having asthma. And to find out what you are allergic to and how to pinpoint the treatment and management, and based on your symptoms and history, your provider may send you to an allergist or immunologist, which is a doctor who specializes in allergic diseases. So depending on the cause of the allergy, you might get sent to do an allergy skin test called a skin prick test. This is the most common type of test for allergies. So what generally happens is the healthcare provider will place a small amount of allergen underneath your skin. So what they do is on your arm, they almost create like a little table or chart. And then within each cell, they put a small amount of the allergen, so different allergens underneath your skin. And then they wait a little while to see if that area will basically have the inflammation, so swell up, get red and or itchy, and they see whether you have a reaction to it. So the skin test is used to identify common allergens like dust mites, pet dander, pollen, molds, and certain foods. So this is a really helpful test because it also helps to identify not only what you're allergic to and what you're not allergic to, but it also helps to identify the amount of reaction that you get to an allergen. So it actually can, you can see, what allergens you need to focus on or you need to really watch out for versus other allergens that you may not have a big reaction to as the other ones. So common asthma triggers, I've already mentioned some, but I'll mention a little bit more. So dust or dust mites, pollen, mold, animals, like usually pet dander, smoking and exposure to smoke or vape, air pollution, weather changes, so humidity and cold air, exercise, chalk dust, building repairs. Certain foods can cause allergies as well. Cold and flu viruses, and strong odors such as perfumes, cleaning products, and scented markers. So after I've spoken about allergies, I'm going to just go back to how asthma is treated. And I'm going to speak about how to actually, if you have both asthma and allergies, how to sort of manage everything so that we make sure that we treat your asthma and we make sure that you are well controlled. And so what I really want to drive home is these three key points. And they're not in any order. It doesn't mean that awareness and avoidance of triggers is more important than medications. But I just want to really drill how important these three strategies are. So the awareness and avoidance of triggers is really, really important so that you actually prevent you from being exposed and prevent that initial inflammatory cascade or reaction that can happen. And then the next one is medication, so making sure you're on the right inhalers and you're actually taking your inhalers properly and as prescribed. And then you might have added, in addition to your inhalers, any allergy medications depending on the specific allergy and what your doctor will prescribe. And then definitely last but not least, overall goal to achieve good control, and I'll be talking about an action plan. So the whole key message here for treating asthma is control, control, control. And I can't say it enough, but control is really important because we can achieve it. So I'll be first talking about awareness and avoidance of triggers. So I'll talk about some of the few common asthma triggers. So common allergens like pets. So animals shed hair, feathers, and dander or dandruff. So if a pet is making your asthma worse, the best option by far is to find it a new home. It's not easy. I've had patients that I needed to talk to with regards to removing their cat or dog, and it's they're just so attached to it, and it's really hard to do so. So if it's really not possible to find it a new home, make sure to keep the pet out of the bedroom and off the furniture. Or areas where you'll be spending a lot of your time at. Have someone else brush your pet regularly, bathe them frequently if necessary to remove dander. Remove all carpeting because their dander can get stuck in the carpeting and furniture. Use HEPA filter air cleaners. Vacuum furniture regularly with a HEPA filter, and ensure that you are taking your inhalers properly and as prescribed. Other common allergens include dust mites. So dust mites are tiny microscopic insects that feed on our skin flakes in our beds and carpets. So if you are allergic to dust mites, the following may help. Try to encase mattresses and pillows in allergy-proof covers. Use synthetic and washable blankets. And try to wash your linens in hot water every week to try to get rid of all those dust mites. Keep stuffed animals to a minimum. Remove carpeting if possible. Again, vacuum furniture regularly with a HEPA filter, and then ensure that you are taking your inhalers properly and as prescribed. So you will see in these next few slides that I have the last point in there for all of them, because it's really important to take our inhalers properly and as prescribed with the right technique. It will just provide that protection on an ongoing basis. So sometimes it will be obvious whether you are exposed to a known trigger, but sometimes it may not be. And that is when we get into trouble, because some people may feel that I'm not going to be exposed to a trigger that I know that will cause a trigger, and then they sort of take a vacation from the inhaler. But that shouldn't be the case. And, your inhalers provide that ongoing protection on your lungs so that, you minimize the amount of flare-ups and exacerbations that you can get. And I'll be going into that a little bit more detail in the medication slides. Other common allergens include pollen, so especially in the spring and fall, but pollens can be sort of caused at any point. So pollens are tiny particles that come off trees, grass, and weeds. So if you are allergic to pollens, the following may help. Keep windows and doors closed in the home and car during pollen season. Air conditioner is often needed when it's hot outside because you also don't want to get exposed to extreme hot weather as well. After being outside for a long time during pollen season, try to shower and change clothes. A person with allergies to pollen should not mow the lawn if they are really allergic to grass pollen. That's really important not to do, to mow the lawn, have someone else do it. And then again, ensure that you are taking your inhalers properly and as prescribed. Some of you may have heard that people tend to have their asthma get worse after a thunderstorm. So there's a phenomenon called thunderstorm asthma. So scientists have actually found that during a thunderstorm, when there's like wind gusts blowing, it brings the pollen that's in the ground up to the clouds. And then, when it falls, then you get sort of the spread of all this concentrated pollen. And so it's really important during those times as well to limit your exposure outside, or limit it like completely if you can. And close your windows and doors during a thunderstorm because that can actually cause an asthma flare-up or exacerbation. Other common allergens include mold. So molds can be indoors in damp basements and bathrooms, and outdoors in damp weather. So you can see in that picture, it's that black in the corner of that window casing. You can see that black pattern, that's mold. And so it's really important to ensure that we keep the moisture level in our homes or in our living spaces at a minimum. So we try to say to keep the humidity below 50%. And so what we do, what we recommend is to purchase a hygrometer, which measures relative humidity. You can get it at any hardware store, and they're fairly inexpensive. I've actually heard of people also purchasing it from like dollar stores, for example. So it's really important to keep the relative humidity level below 50%, because above that just invites an opportunity and environment for the mold to grow and multiply. And once the mold grows, it grows quickly and it spreads. So it's really important to prevent it from happening in the first place. And once it grows, it's really hard to get rid of as well. And so that's why prevention is key. Try not to carpet bathrooms or other damp rooms such as basements. A dehumidifier can help, especially in damp areas. Try to get rid of clutter to allow for better ventilation. We also, especially in basements where it tends to be our storage area, where we have boxes and boxes of stuff that we just shove across to the walls, the corner of the walls. Some of the times those can be the most dangerous, because we put that there and we forget about it, and we may not know that with the humidity in the basement that it actually, with the clutter and with the closed spaces, it can actually be the perfect environment for mold to grow. And so we do recommend people to get rid of their clutter, or at least make sure not to push the clutter and push the boxes all the way up to the walls. Seek professional help if indoor mold doesn't go away or is uncontrolled. And then again, ensure that you're taking your inhalers properly and as prescribed. So I'll be talking about some irritants. So common irritants are smoke and vape exposure. So smoke from cigarettes or other products such as vape and cannabis can be dangerous, especially for people with asthma. So if smoke triggers your asthma, try to avoid smoke always. If you can avoid it, never allow smoking anywhere in your home or car, even if the person with asthma is not there at the time. Smoke can linger around for a long time in furniture, in carpets, in curtains and such. And we call that third-hand smoke, is when it gets stuck in clothing, carpets, and even that smoke that lingers on there can actually cause a trigger for your asthma. So if you smoke, try to quit. There's lots of helpful tools that are out there. There's a smokers helpline, so the smokershelpline.ca you can access. They have counselors. They have lots of tips and tools and resources that you can access. For those in Ontario, the Centre for Addiction and Mental Health, CAMH, actually has a community program called STOP, which provides free nicotine replacement therapies for those who are willing and committed to quit. And so it just prevents or takes away that barrier of some people, they may have a difficult accessing these NRTs or have a barrier to purchase a lot of these costly treatments. So it has really helped and has been really successful in Ontario so far. And then again, ensure that you're taking your inhalers properly and as prescribed. Other common irritants include air pollution. So air pollution comes from many sources, including vehicles and industry. Highest pollution levels tend to be during the hot, humid days of summer, so just be mindful of that. So reduce exposure to air pollution. The following may help. So reduce or avoid outdoor activity when the pollution levels are high. Keep windows and doors closed when the levels are high, and air conditioning may be needed when it gets hot. And then ensure that you're taking your inhalers properly and as prescribed. In Canada, we have something called the Air Quality Health Index, or AQHI. Some of you may have heard it before, but for those who haven't, this is the Air Quality Health Index, or AQHI, is a scale designed to help you understand what the air quality around you means to your health. So what the Government of Canada has done is they've actually, they do live readings of air quality in various regions, even minute communities, and they actually have a list on their website if you go to the website. And the AQHI is calculated based on relative risks of a combination of common air pollutants that is known to harm human health. So these pollutants are ozone at ground level, particulate matter, and nitrogen dioxide. So we tend to use the scale to recommend when it is generally safe to go outside and do your activities or when it's not. So people who are at higher risk, so people living with lung disease such as asthma, COPD, we generally tend to recommend that they go out when it's a low risk, when it's at a 1 or 2 or 3, and we generally advise them to not go out or minimize their exposure when it's a moderate to high risk. And so if you go on this website, it actually gives you a really nice picture of your community and what your air quality health, or AQHI, level is at that day. So it really helps to manage the way you plan your day, as well as manage your symptoms. So another big one in terms of avoidance of triggers is infections, or respiratory infections, to be a little bit more specific. So any respiratory infection, so that's including cold, flu, RSV, COVID-19, those have been really big in the last several years. It can make asthma worse during the infection. So in terms of those infections, it doesn't mean that when you have asthma, you have higher risk of getting those infections, but it actually puts you at higher risk of developing severe illness from those infections. And so that's why it's really important that we manage that as well. So get up to date with vaccinations. So up to date with flu, now COVID-19, and also the pneumonia vaccine, or pneumococcal vaccine. It just, not only do the vaccinations help to prevent you from getting the infection or illness, but it also actually prevents you from getting severe illness. So it's, it's not 100%, perfect, and it doesn't prevent you from getting it at all. But what it does, it really prevents you from getting severe illness from it. So wash your hands regularly. Some of you guys are really well versed in this in the last several years, but wash your hands regularly or use hand sanitizer if soap and water is not available. Stay home when sick, wear a mask, have a balanced and healthy diet, and exercise regularly. And also I would add to that sleep. Sleep is very important for your immune system to work properly, and ensure that you're taking your inhalers properly and as prescribed, and have an asthma action plan in place and follow it. I will be talking a little bit more detail on that in a few minutes. So How is asthma treated? We just talked about awareness and avoidance of triggers. We're now going to be talking about medications. So in terms of asthma medications, really the goal is to maintain control with the minimal level of medications with the least side effects. So work with your healthcare provider, make sure you're on the right medication and the right dose in order for you to maintain a level of control. And we'll talk about the control criteria in a little bit. Medications can differ from one person to the next, and it's different for everybody. And inhalers are the gold standard to manage asthma, but there may be a need to add in medications to address the allergy as well, depending on how severe your allergy may be and how it does affect your asthma. So when we talk about medications, there's sort of two families of medications. So one is called a reliever or rescue, and the other is called a controller or maintenance. So the reliever or rescue inhaler, it relaxes. So I'm going to show the picture again. So it relaxes the muscle bands around it. So those elastic bands that I talked about earlier, it works to relax those muscles to open the airway. So instead of having the muscles strangle your airway, it helps to relax it so it makes it nice and open. The reason why it's a reliever or rescue is because it acts quickly, but the downside is it wears off quickly too, and that's why it should not be used on a daily basis. It should not be used as a regular controller therapy, which is the reason why we have controller and maintenance inhalers, and these are the go-to for managing asthma. So some are used to relax muscles, and some are actually used to reduce the swelling in the mucus. So some are used to those muscle bands around it. It works to open it up, and also some are used to work around the inner lining of the tissue, the airway. It acts to reduce the swelling, and it acts to reduce the mucus buildup in there as well. But also some can be a combination of both. In the last several years, inhalers have really gotten sophisticated, and really there's a lot of choices that your provider has now in order to really pinpoint and really help you find the right medications. And also there's different devices as well which may help with compliance. If it may be difficult for you to take one device, it may be easier to take another. So really, you really need to take time with your provider to determine that. So the thing with controllers and maintenance is that it takes time for it to work. So it's not that if you start taking it today, you're going to find that you're feeling the effects of it tomorrow. Sometimes it can take weeks for it to actually take a hold in your system, and that's why we do say that you should not take a vacation from your controller, because if someone thinks that they can just start taking their controller once they know they've been exposed to something, or they are starting to have asthma symptoms, that is just not the right place to take it. It's important that you always take it all the time so that you have that level of control all the time. With controllers, it does take time. It doesn't act quickly. Like, for rescue reliever inhalers, it takes 5 minutes to act. The controllers take a little bit more time, but it does last long. So some last 12 hours and are taken 2 times a day, and some last 24 hours and are taken once a day. Inhalers are only as good as its user. So as good as your medication may be, it's only as good as how you take it. So taking your inhaler with the right technique and taking it as prescribed is so important to asthma management. So if it's prescribed twice a day, you should be taking it twice a day, not once a day. If you have a respiratory educator or CRE that is available in your community, highly recommend them. They're specialized in educating and managing people and teaching you inhaler technique, and so it's really helpful to seek one if you have it in your community. If there is no access to a CRE in your community, then talk to a primary care provider or pharmacist, and they can help you with that. There's excellent online resources available. So if you go under, so in Canada, LungSask has done some great videos and great productions on these inhaler videos. They actually have one for every one of the inhalers that are out there, but I'll be showing you an example of one that they have, which is taking an MDI with a spacer.
Remove the caps from both the inhaler and the spacer. Shake the inhaler. Insert the inhaler into the spacer. Breathe out. Seal your lips around the spacer mouthpiece. Press the inhaler down once and breathe in slowly and deeply. If you hear a whistle, you're breathing in too fast. Remove the spacer and hold your breath for 5 to 10 seconds. Breathe out. If another puff is required, wait at least 30 to 60 seconds and repeat all these steps. Replace the caps and then rinse your mouth with water. Please note, if you are unable to hold your breath, take 6 normal breaths instead.
Okay, that was just an example of one of the videos that they have, but if you go on their website, you will see a lot of other inhaler videos that may be relevant to you. So I'm just going to go to the next slide. Sorry. There are other controllers other than the inhalers that can be used in addition to, but some actually use it if the inhalers really don't work, but we do recommend that the first line of therapy for asthma should be the inhalers. And then there's also what's called leukotriene receptor antagonists, or LTRAs, that can also be used to manage asthma. What it does is when you're exposed to the trigger, a whole inflammatory reaction occurs, an inflammatory cascade occurs. What LTRAs do is they block the inflammatory pathway from even starting. It usually comes in pill format, such as singular accolade, and can be used also to manage asthma. Other medications include biologics. So biologics are used for people who have severe or persistent asthma symptoms, even though they're on optimal inhalers. So usually inhalers, we go through inhalers, and then if, even though you're on the strongest inhaler, or even though you're not, you're doing everything that you're supposed to in terms of controlling your environment, it's still not, your asthma is still not under control, then your provider may speak to you about using biologics. So each biologic works differently and specifically, so your doctor may do some tests, usually blood tests, to find out which one is best for you. And biologics are not for everyone. It's intended to be used by people with severe asthma that is difficult to control with a standard reliever and controller medications. So that's why your doctor will probably try a variety of reliever and controller medications before suggesting a biologic. So the reason why they will do tests on you is to determine which biologic is best for you. And biologic treatment is usually given as an injection at your doctor's office or special clinics, usually every 2 to 4 weeks, depending on the particular medication. So how they work is for asthma, when exposed to triggers, usually it involves antibodies, inflammatory molecules, and cell receptors, and they go into action to create an inflammatory response. Biologics target these molecules by disrupting the pathways that lead to inflammation that causes asthma symptoms, and so they work with that mechanism. I'm not going to be talking too much about it, but I do want to share with you one of the older biologics that have been on the market for a while. In the last 5 years, there's been just a rush of biologics that have come on the market. And so I'll just share with you one that we have been using for several years. It's called Zonier. It's an anti-allergic medication. It's used to treat moderate, severe, persistent allergic asthma, and it's for severe and inadequately controlled asthma despite controls. Like I said, it must be supervised by an asthma specialist. Other biologics, newer biologics that are available are Nucala, Fasenra, Sinclair, and Dupixent, and those can be used as a treatment option for those with severe asthma. So in addition to inhalers and asthma medications, you may also require some allergy medication. So treating your known allergy may help to also get your asthma under control as well. So those include antihistamines such as Benadryl, Claritin, or Allegra. So antihistamines block histamines, which gets released when you get exposed to an allergen you're sensitive towards. Histamines are what causes the allergic reaction or inflammation. So it's kind of similar. It tries to block the inflammatory cascade from happening. And then you have decongestant or nasal steroid sprays. It reduces the swelling in your nose. And then also allergen immunotherapy that are available for specific allergens that you have, such as grass allergen, ragweed allergen, and they also can work to target those specific allergies that you have. So the last thing I'll cover is the overall goal to achieve good control. So on top of awareness and avoidance of triggers and taking your medications properly, your overall goal is to achieve good control because it can be achieved. So the Canadian Thoracic Society, or CTS, is the body in Canada that comes out with guidelines and treatment, evidence-based treatment management strategies for asthma. And this is the control criteria that they've come out with most recently. This is from their 2021 guidelines for asthma. And so you can see here, this is the threshold. So if you meet all of these criteria, then that means your asthma is well controlled. If you don't meet even one of these criteria, that means your asthma may not be under control. So what control means, it means you have daytime symptoms, so that includes the coughing, wheezing, shortness of breath, chest tightness, less than or equal to 2 days a week. You pretty much have no nighttime symptoms, or on average less than 1 night a week, and the nighttime symptoms are mild. You shouldn't have any disruption to your physical activity. You shouldn't have any barriers to doing everything that you have been doing. Your exacerbations or flare-ups are mild and infrequent. You should have no absence from work or school due to asthma. And in terms of the need for a reliever or rescue inhaler is less than or equal to 2 doses per week. And that includes for exercise. So some people may think, I just take my rescue inhaler 15 minutes before I exercise and it helps me. But the whole idea and the strategy is that you are on the right controller medication, that maintenance medication, in order to achieve that level of control always, so that it wouldn't actually, you wouldn't actually need to take your reliever inhaler even before exercise, for example. And I missed talking about this, but it's so important with controllers, and think about it as, if you had high blood pressure or diabetes, you would always take your medications on a daily basis, even though your blood pressure may be normal. And so that's what I always tell my patients is that your controller medication for asthma, it keeps your asthma symptoms at bay to maintain that level of control, and that's why it's really important not to take a vacation from them. The last three we don't use it as much. Some may be used in specialty clinics such as sputum eosinophils. But basically when you do spirometry, your forced expired volume in the first second, or peak expiratory flow, is greater than or equal to 90% of personal best, and the diurnal variation of your peak flow. So there is a variation throughout the day of asthma symptoms. So your peak flow may be lowest in the morning and then highest, in the afternoon or early evening. So that variation, there shouldn't be a huge variation to that level when you do the calculation. But when you do see a variation of, let's just say 20% and greater, then that may mean that your asthma is not under control. And then again, that sputum eosinophil level is usually measured in a specialty clinic. Some worsening signs of asthma include coughing, wheezing, shortness of breath, chest tightness, or increased mucus. And a flare-up may be caused by what we already talked about: infections, allergies, stress, anxiety, exercise, air pollution or poor air quality, smoking or secondhand smoke. We do have an evidence-based tool that we can use. So an action plan is a tool that can be used to ensure you're taking your medications every single day. It's a tool that helps prepare yourself to manage a flare-up when it comes on. And treat it right away. It helps you identify when you should see your healthcare provider or seek medical help in an emergency situation. And your primary healthcare provider may actually increase your medication on the action plan in case of a flare-up and have it ready at the pharmacy for you. Some may require you to call the moment your symptoms get worse so that it can be managed in a timely manner. This is just an example of what an action plan looks like. There are several that are out there, but this is one that's from the Lung Health Foundation. There's actually a different one between adults and children, because with adults or people who are 16 and over, the guidelines actually recommend in that yellow zone a step-up therapy strategy, whereas for kids under the age of 15, that may not be the case, and they have a different strategy that they go with. So basically, I'm going to walk you through the different zones. So it's a traffic light system. So green means go, yellow means caution, be careful. This is, when you start to get symptoms and you start to see a flare-up happening. And then you'd never want it to get to the red zone, which is, stop. This is the emergency zone. This is when you should be seeking emergency help. I always tell my patients that sometimes it's inevitable that you go back and forth from the green to the yellow zone, but you want to make sure that it is you are going back from the yellow zone to the green zone, and you do prevent that transition from the the yellow zone to the red zone. So in terms of the green zone, you have all of the following. So you're using your reliever no more than 2 times per week. You're coughing, wheezing, shortness of breath, or chest tightness. You're experiencing no more than 2 days per week, daytime symptoms. You can do all of your physical activities and sports without difficulty. You have little to no nighttime symptoms, so it's less than 1 night per week, and you're not missing any of your regular activities or school or work. Some people also measure peak flows, and that should be greater than equal to 90% of your personal best. And then you write your green zone medication, what you use to maintain that level of control. The yellow zone is when you have any of the following. It could be one of the following. So using your reliever, this is acute loss of control. So using your reliever more times, so 4 more times per week, having those asthma symptoms 4 more days per week. Your physical activity, you're noticing that it's limited due to your symptoms. You are experiencing nighttime symptoms, and you are also noticing that you're missing school days or work days because of your asthma. Your peak flows, you may also notice that it's dipping. So you're now at 60 to 80% of your personal best. And for adults, your doctor may prescribe an increase in your control medication, whether that be an increase in the number of doses, or it could be that they add an additional controller to your regimen just during this time where you're trying to get over this hump. You'll probably be also using your reliever inhaler as needed. And then if your symptoms do not improve within 24 to 48 hours, then you should probably be contacting your doctor again. If you're actually noticing that your symptoms are getting worse, even after you've done all those step-up therapies, then it probably means you're in the red zone. So that means that you have any of the following. So reliever is lasting 2 to 3 hours or less. You have continuous asthma symptoms, so that continuous cough, you're wheezing all the time, you have severe shortness of breath, you're not able to speak in full sentences, and then you just have a severe, severe symptoms. And your peak flow, you probably can't even do it, it's less than 60% of your personal best. That's when you should just take your reliever every 10 to 30 minutes as needed while you're waiting for the ambulance to come and take you to the emergency room. This is what a pediatric plan looks like as well. So it's very similar. It uses the same traffic light system. And the only difference really is that in the yellow zone, it just says to take your reliever puffs and then continue to take your green zone medication, so no step up. And then your doctor may actually prescribe an oral steroid if required. And then so the whole concept is the same. We really want to have this in place so that we are all informed of how to manage and watch out for symptoms, and to make sure that we're taking our medications, our control medications on a daily basis as prescribed. Another tool that we can use on top of an action plan is called an Asthma Diary. It's a tool to help you keep track of asthma symptoms, medication use, peak flow meter readings, and asthma triggers. It's not for everyone, but for people who really like to keep track and really find it helpful to visually see a trend in their asthma symptoms, whether it go in and out, and whether they want to see whether their asthma is getting worse at certain times of the month, or they keep a record every month to see if their asthma symptoms get worse at certain times of the year. Then it's a really good tool for that. So the top purple section shows your record of all your symptoms, and you note the severity of it. The middle section is where you write your medications and how many times you've used it. The blue section is where you would take your peak flow meter readings, and then you would write all your triggers in that red bottom zone there. So peak flow meters, I'll speak very briefly about it. So the purpose of a peak flow meter, it looks like this. You can get it at any pharmacy. It's the amount of air you can blow out that changes depending on how healthy your lungs are. So peak flow meters measure how fast you can blow air from your lungs. So what you do is you set it to 0, you take a deep breath in, and then you put your mouth on the peak flow meter mouthpiece, make sure you have no leaking around the area, and you blow really fast and hard as you can. That dial will go up to that, that whatever high reading that you have, and it actually gives you a score. And if you have an asthma flare-up, you will not be able to blow out as much air as usual. And so this will also make your peak flow score go down. And so that's when you might notice that your asthma may be getting worse. It could be a precursor to the symptoms even from coming on. So it's sometimes a good measurement, although it does have its faults because it is effort dependent. And so we need to make sure that we're taking not only one reading, but multiple readings to make sure that we are getting an accurate reading. And also to take it at the same time and with the same technique every time in order to make sure that we're being consistent with the readings that we're getting. The last thing I'll be talking about is anaphylaxis. And so what is anaphylaxis and why is it important for us to know about it? So anaphylaxis is the most serious type of allergic reaction. It can be life-threatening, especially in people with asthma. So it's that double threat of, not only having a severe allergic reaction to something, but, your asthma is also going to get affected as well. And, it tends to be life-threatening because that's when your airways start closing up. It can be diagnosed at any age, but are most often diagnosed in childhood. Common triggers are foods such as peanuts, tree nuts, seafood, shellfish, milk, eggs, sesame, and soy. Other triggers are insect stings, medications, and latex allergies. So how to manage anaphylaxis? So avoidance of the allergen is key to preventing an anaphylactic reaction and knowing what that allergy is, and that's why the skin test is really important. Epinephrine is the recommended treatment when a reaction occurs. So people at high risk of anaphylaxis should carry an epinephrine auto-injector. So epinephrine is actually a hormone your body produces naturally in response to a stressful situation. The epinephrine medication has a similar effect, but increasing heart rate and blood pressure, relaxing muscles in the airway, it reverses swelling, and suppresses the immune response to allergens. So it temporarily halts life-threatening effects of an anaphylactic reaction, which is why it's really important that we carry it and have it available for those who are at high risk. Knowing when to take action is also key. So this is from foodallergycanada.ca. They have excellent resources on allergies, anaphylaxis. They have training for both community as well as healthcare providers. So how do we know it's anaphylaxis? So think fast. So F is face. So you'll notice hives, itching, redness, swelling of face, lips, or tongue. A is airway. So you might have trouble breathing, swallowing, speaking, nasal congestion, and sneezing. S stands for stomach. You'll have stomach pain, vomiting, diarrhea. And T is total body. So you'll notice general hives, itching, swelling, weakness, dizziness, and loss of consciousness. So it's really important that we take note of this to notice when a severe allergic reaction or anaphylaxis may be occurring. So what do you do in the event of an anaphylactic reaction? So this is also from Food Allergy Canada. So if an anaphylactic reaction happens, follow these 5 emergency steps. So step 1, give an epinephrine auto-injector right away. Follow the instructions on the device. Step 2, call 911 or your local emergency department and tell them that you are having, or a family member or friend is having an anaphylactic reaction. Step 3, use a second auto-injector as early as 5 minutes after giving the first dose, because again, epinephrine is temporary. If there's no improvement give it if there's no improvement in symptoms from the first dose that you took. And then step 4, go to the nearest hospital right away, ideally by ambulance, so they can monitor you. Even if the symptoms are mild or have stopped, the reaction could get worse or come back, and that's why it's really important to keep monitoring yourself. And then step 5, call your emergency contact person, whether it be a parent, a family member, friend, whoever that may be, to let them know that you're experiencing this. There's a lot of training resources that are available. So there's some training from Food Allergy Canada. There's also tools and resources that you can download. They also have allergy training for the food service industry. And then some resources for school and patient on allergies and anaphylaxis. You can get it through also the Food Allergy Canada as well. They have an anaphylaxis plan. So similar to the prevalent medical conditions plan or an action plan, there's an anaphylaxis plan that you can have in place at the school or daycare or any care setting. They also have some policy resources in place at Food Allergy Canada, and there's different laws by province and territory, and you could go to this website to see which applies to your province. And this kind of was triggered by Sabrina's Law, and Sabrina's Law requires that every school board have established and maintain an anaphylaxis policy to help students with serious allergies. Sabrina, similar to Ryan, actually had a severe anaphylactic reaction at school from a contaminated tongs in the cafeteria. She was severely allergic to milk allergy. And since then, all these laws and policies have come in place in order to prevent that from happening. You can get more information on Sabrina's Law at foodallergycanada.ca as well. So other general support, so have questions about your asthma, you can, there's really great resources that you can access. There's Certified Respiratory Educators at your fingertips. So we have a National Lung Health Foundation's personalized lung health line. You could talk to a respiratory therapist and a certified respiratory educator. So you can call a toll-free number 1-888-344-LUNG or 5864, or email info@lunghealth.ca, or visit our website to chat with them. Specific to Saskatchewan, you can also speak to a certified respiratory educator, also toll-free 1-833-385-LUNG or 5864. It's toll-free in Saskatchewan between 8:30 a.m. and 4:30 p.m. Monday to Friday, or emailing questions to info@lungsask.ca. We also have an exercise maintenance program that we do, a virtual program called Virtual Fitness for Breath, and it can be for anyone living with lung disease, including asthma, and you can get more information as well as register for our classes on that webpage that I linked. And then a ton of supports available as well. So there's asthma resources from LungSask at their resource library. If you go under their website, they have really cool tools, such as really cool tips and tools, two-pager on the changes to the latest asthma guidelines from CTS. They have smoking cessation resources. They have asthma medication resources for both healthcare providers and people who live with asthma. And then in terms of our Lung Health Foundation resource library, we have all the action plans that I shared with you. We have an asthma attack poster that you can have for your schools and workplaces. And we also have that asthma diary along with many other tips and tools on our webpage. So I would highly recommend you to access both of our web pages, lungsas.ca as well as lunghealth.ca, to get more information. You can also volunteer with us, tons of volunteer and advocacy opportunities. You can contact info@lunghealth.ca. And for healthcare providers, we've recently rolled out an asthma best practice toolkit, which was developed by a clinical advisory board, including the members from LungSask. And we've curated evidence-based tools not only from Canada, but across the world on how to better manage asthma in the community. So the key message, the take-home message is get properly diagnosed and continue to follow up with your primary care provider to ensure you're on the right treatment. Know your triggers, your allergens and irritants. Know how to avoid those triggers. Take your medications as prescribed with proper technique and have an action plan in place, whether it be if you have anaphylaxis, you should also have an additional plan for that as well.